We're here to enrich the lives of children and families with hope, health, and happiness. And those words speak now more than ever around this pandemic.
Hong Kong is taking emergency measures as a mystery pneumonia has infected dozens in China's Wuhan city.
The White House has issued new travel warnings as the U.S. reports its first confirmed death related to the coronavirus.
New York becomes the epicenter of the coronavirus outbreak as thousands are infected. Governors begin enacting stay-at-home orders.
The United States reports 100,000 deaths related to the coronavirus as states begin to reopen.
No one knows when this will be over.
We knew the governor was going to be announcing that we should stop visitation in our facility. And the night before that happened, we called all of our families to kind of give them a heads up that this would be announced. And it's a big deal to say that you can't come visit your child. Thinking of it as a mom and as their pediatrician about how they were going to respond, I was thinking, this was going to be really hard for a lot of the families to hear. But what happened as I started calling the families is they were telling me thank you. They were saying it through tears, but they were saying thank you for keeping their child safe and for being proactive. It's hard when a parent asks you to hug their child for them or tell them good night because they can't be there. And I think our families are so amazing. They've been through so much with their kids. Their lives have been very difficult. And for them to have one more thing added to their plate is really hard to see. They were so grateful that we were trying to take all of these steps to protect their kids. And that was a night I will always remember.
The children and families that come to us at Home of the Innocents come to us under very different circumstances. In Kozer Charity's Pediatric Convalescent Center, a child, once they become a resident and they begin receiving activities, therapy, compassionate nursing care, you know that the miracles are beginning to happen when the child begins to engage with our team member.
At any point in time during the day, there's certified Jefferson County Public School going on. There's PTOT speech therapy sessions going on. There's exceptional compassionate nursing and respiratory care going on. This is a place unlike any other that I've ever been. There is so much happening 24 hours a day here. And at the heart of it all are these children. Everything everyone does every day we come to work is for these kids.
When a child comes to us for treatment in our residential program or our emergency shelter, once they walk in the doors and they transition, that's when the healing begins.
Our kids are at the home because they come from a very dark place. They come from a place that we cannot imagine. A place of hurt, a place of pain, a place of pure trauma and torment.
It's one of those things where you hear stories about kids that come from different demographics and backgrounds, but you don't realize how close to home it is. A lot of these kids have never had any consistency in their life.
And then they come here to the home, and we change that. We give them what they haven't had. To see them go from, I hate myself, I want to hurt myself, I'm going to cut myself, I'm going to hang myself, I'm going to destroy myself, and in the process, I'm going to destroy this place. But we don't stop because we recognize that, and we're going to love you anyways. Because even though you expect us to turn our back on you, and you expect us to get angry, and you expect us to get fed up, we're not going to. We're going to still be standing there with compassion, with love, and we're going to say, whenever you're ready, we're here for you.
To see a kid put in the work and actually become successful when they leave here, and they're going to be, it's almost like watching your own kid grow. I think that is amazing. To actually see the transformation, that means a lot. That's the one that, just that's why I do what I do.
In Open Arms Children's Health, When a parent brings their child in for a doctor's appointment or a dental appointment, or maybe they're having their hearing checked or they're having their cochlear implant turned on, you know that a conversion has happened because the family walks in, they know the staff that they're working with, and they begin to see improvements in their child's health.
So Open Arms Children's Health services a wide variety of children. Our refugee population, we also service children in foster homes. We service children in the general public. Anybody can come use Open Arms Children's Health. It's a really special place to be. It's a really important organization for the community. Each individual service that we offer, sure, it's one type of service, but when you bring it all together, it's the heart of our city.
When I would talk to the kids about what was happening and why they couldn't go to school and why they couldn't visit with other people in the building, and lots of times their response would be, well, it'll be okay. And, you know, they're right, it'll be okay. And, you know, they were ready to move on to the next thing. And I think that says a lot about their feelings of safety in our building and them trusting us as their caregivers. Through all of this, it's just made me realize how every person who works at the home, we all really have that same passion for the kids. Like, we all are on the same path. And I think that if we always look back to what our mission is and what's important, that we'll never be steered off course as to what's the best thing for our kids.